Sorry, I took just a teeny little break to turn on my air conditioning. I don't know if you noticed that or not, or missed me, whatever. But anyway, so we're going to go through the syllabus now. That way we won't use class time to go through the syllabus. I think the syllabus is really important, but I want you to have the information. But we got a lot of stuff in class to cover in 8 weeks, so that's why we're going to do this ahead of time. I will post this on Blackboard as your syllabus movie, and I do expect you all to watch the movie and have your syllabus. So if you don't have your syllabus yet, put me on hold and go get the syllabus, print it off, pull it up on your computer, whatever you have to do. Get some pencils and markers so you can write things down on here, because there's a lot of important information. It's a big syllabus, looks like this. So we're going to go through it all. Some of it we're not going to touch so much on, just for the simple fact that it's all in the other syllabuses that you've had. Syllabi, I guess, is the word for it. So that's what we're going to start with. So the first thing is, our class is called Nursing 3400, and it's nursing of children, women and childbearing families. Okay, you've already had peds, so this is just an extenuation of the peds thing. We're going to go up to women and how they have their babies. Okay, my telephone number in the office is 402-465-2548. Please call that one on Monday through Friday. I'm usually here between 8 and 8:30, and stay till about 4 to 5, somewhere in that area. And then I also have a cell phone number for you. You can write down if you want to, 402-310-4673. And that cell phone number is available to you to use if you have an emergency, or if it's on a weekend, or just something has come up and you just don't know what to do with it. But call my office phone first. And for the cell phone, you can either text me or you can call me. We can do it either way. Or an email always works too. I check my email all the time, every day. So email would be the way I want you to get a hold of me first. And if you don't hear from me by the time you need it or sooner, then you can text me or call me. Okay? My email address is vwenzel@nebrwesleyan.edu. The location for our class right at this point, and we're just at the end of September now, so things could change, but we were going to be in the Weary Center, room 105. And I've already looked at that room, and there's a lot of desks in there, and it might be a little crowded for us, but we're going to see how it works. Day and time of class are Tuesdays and Thursdays from 8 in the morning till 9:50. And of course the session is the second 8 weeks. So you get, I don't have our clinical on here. Okay. Credit hours, you get 2 theory credit hours and 1 clinical credit hour. So you get 3 credits for this whole class for us. And this includes the clinical and the theory class, okay? So prerequisites, nursing 2110, 2180, 2350, and 2710. This course focuses on the provision of nursing care of the family unit during the antepartum, intrapartum, and postpartum experiences of birth, including high-risk situations. Assessment and nursing care of the newborn is included. Clinical experiences will include the care of the obstetric patient and her family in the acute and community care. Course is over an 8-week period, which includes theory and clinical, which we've already talked about. So program learning outcomes for our class are, you're going to function as a baccalaureate generalist practitioner by translating, integrating, and applying concepts and knowledge from liberal education, including humanities, behavioral, computational, natural sciences for nursing care across the lifespan and within the continuum of healthcare environments. And actually, I'm going to let you guys read the rest of these, because I think they're pretty much the same no matter where you go, whichever class you're in. Okay? And then the course objectives are also in here. They're on the next page. Okay, and I think these course objectives are a little bit like what you've had. I am going to let you go ahead and read them on your own. If you have questions about either the learning objectives or the course objectives, please let me know, and we'll figure it out. The third page of your syllabus is all the where the course objectives fit. So you can look at that, and it's nice and pretty. It's got some red and some black in it if you printed it in color. Okay, your required materials, we're going to be on page 4. Your required materials are, first you need your APA book, and that looks like this. So this is your APA manual. This is a requirement for the course. If you have this book, The Littlest Seagull, you can use it instead, because I think it's got everything in it you need it for A&P for APA, and I know that they're starting to integrate this into some of the Archway curriculum. So if you have this book, that's good too. Okay. The other book is Nursing Central. It's not a book, it's a program. Nursing Central, that's where you can get all your diagnosis and your meds and your everything you need. So that's a web-based thing. If you don't have it yet, I want you to get it. You'll also need a vSim web-based simulation, and you should have gotten this for pediatrics, because I know you used it in pediatrics for the vSim, and hopefully you purchased both the one that's for maternity and pediatric simulations. If in PEDS you only purchase the pediatric one, you're going to need to go buy the maternity one, because you'll need that for us. Okay? And there is a website on here where you can go get that. Our book this year is new, and it is Warden Hisley, Maternal Child Nursing Care, 2nd edition, Philadelphia, Pennsylvania, by F.A. Davis. Now, what I'm going to tell you, as I find the book, this is what the book looks like. It'll have it in the library. You can probably find it on Amazon, wherever you want. Okay? It's a great book. I love it. It's the first time we're using this book. If, when we're doing work and you have to do your citations and your references, the way this is referenced in your syllabus is how I want you to reference our book. I will not accept any other reference except this one that's in here, Warden Hisley. Okay? Okay? And then required computer software for this course and for every other nursing course that you have is Reference Point Software, and there's a website there too. That is also a requirement you need to have. Okay? Then Nebraska Wesleyan's commitment to students with disabilities. I know that we've all seen this before, so I'm going to let you read that. If you have any trouble or anything you need to talk to me about, please let me know. Okay? And then the next page, page 5, I hope your pages come out the way mine did. I'm not sure, but we'll see. Is your Title IX information. So I am responsible for maintaining a safe learning environment on our campus. I also have a reporting responsibility, and that's not just as an instructor, but it's also as a nurse. I have a reporting responsibility just like you do as a nurse and as a student nurse. Okay? So Title IX prohibits violence, harassment, discrimination based on sex or gender. And we want you guys all to feel like you can share any information with any of us. So read this part over too, okay? So you know what's going on. There are some telephone numbers in here if you need them for off-campus and on-campus and Title IX resources. Statement of academic integrity. This is really important. It's one of the basic principles of the university community. Nebraska Wesleyan encourages and expects the highest standards of academic honesty from all students, so that means you can't cheat. If I tell you you have to work on a paper alone, you have to work on a paper alone. Okay. The Student Code of Ethics, or the Student Code of Conduct, states that cheating, plagiarism, or other forms of academic dishonesty are subject to disciplinary action. Okay, and there is a Student Code of Conduct for you to refer back to in your student manual, so go look at that. So anytime plagiarism, anytime you take something out of a book, out of another article, anything that you had to look up, you have to cite it and you have to reference it. If you don't do that, that's considered plagiarism, and we could all get in a lot of trouble for that. So please do the APA thing with one of these good books or your reference point, and make sure you cite it and you reference it, everything that you take out of another book that's not yours. Okay? Student assignment submissions. Students are required to submit an electronic copy of written assignments. Electronic copies of presentations may be requested by faculty members. Electronic versions of papers and presentations will be stored for up to 3 years and then destroyed. The student work may be reviewed by the nursing program accreditation visitors. And all that means is when the the accrediting body that accredits us comes in, they sometimes want to look at student papers, and we would let them see your papers. So just so you know that. Okay, page 6, electronic portfolio submission. There are an electronic portfolio submission for everybody, and I think the one for this class is your preclinical assignment, which we'll talk about in a little bit. Okay, so you might want to read over that electronic portfolio submission. Electronic communication. Students are expected to have access to a computer and check their Nebraska Wesleyan email on a regular basis. If your homework is late or you didn't get it done, don't come to me and tell me your computer broke or it's in the shop, because there are computers all over this campus that you can use, and I expect you, if you don't have a computer at home or in your dorm room, that you go find a computer you can use and get your work done on, okay, on time. There is a lot, you guys have to pay attention to your email, because that's how I keep in contact with you. I use the announcements on the blackboard. I also send out a lot of emails, and I do expect you to email me back that you got the message and you're answering the question, or you're going to make an appointment with me or whatever. So I do expect you to do all of that stuff. Okay? You can also get your Wesleyan email at any computer at home. All you have to do is get into Wesleyan, and you'll be able to do that. Okay? Recording in the classroom. Students may not video or audio record class sessions without the instructor's knowledge and permission. And we don't usually have a reason to record or anything like that. Permitted recordings are to be used only for the individual student's educational review of the class session, and they may not be reproduced, posted, sold, or distributed. I myself do not want to be videotaped, but I want you to take notes. I think you learn best by taking notes. You cannot utilize your electronic devices, and cell phones need to be turned off during class. I don't want to see anybody doing some instant messaging or doing Facebook while I'm talking, because I'm going to expect y'all to be a part of the class, okay? Utilizing online library databases to find articles. This is the same thing you're going to find in all of your other classes, so I'm going to let you read through that one. Attendance for the theory part of it, we're on page 7. These are points awarded for participation and attendance in the course. The student is expected to be punctual and attend classes. A percentage of the student's grade is based on class participation. So if you're late, you're going to lose a point. If you miss a class, you're going to lose another point. So you need to just be cognizant of that, so you know that you want to be on time for class. Even if you come just a little bit early, you might have a question for me, or I might have a question for you. Repeated tardiness and absenteeism will be reflected in the course grade. If you do not attend, are late in arrival, or leave early, you will lose the opportunity to earn these points. There are no excused absences for any reason. And I want to think that last year weather was an excused absence, but I'm not really sure how that goes. But right now this is telling you none. Okay? Attendance and participation are considered key elements of student success in the nursing program. Missing even one day in an 8-week course is equivalent to missing 2 days in a full semester course. So that's a lot when you have to get all this stuff in 8 weeks. Students are expected to be prepared for class and participate in class discussion. Refer to the student assessment and self-evaluation rubric posted on Blackboard for guidelines. Attendance in nursing courses is mandatory. Tardiness and class absences will decrease the overall course grade and are considered unprofessional behavior. So that's kind of a big thing, okay? Written assignments. All written assignments are to be typed, double-spaced, and proofread prior to submission. Make sure that you proofread them and you don't use the wrong two, you know, like there's TWO and TO and TOO, or the wrong there, THERE and THEIR. Make sure you use the right one, okay? See specific guidelines for each written assignment. Written assignments must follow the APA guidelines. No paper copies will be accepted. They all have to be put up, posted into Blackboard for me. Assignments turned in late after the due date will receive a deduction of 5% per day. Okay. On the next sheet, looks like this, and I'm sure you all seen it. This is your BSN SAS, which you will fill out the last week of class. And it's here. I've also got it posted on Blackboard for you. Okay. And the next sheet is the rest of the SAS. And now we're going to get into course assessment, which is page 10 if you're following along. So the first thing is the grading scale for Nebraska Wesleyan Nursing Program. Okay. A final course grade of C is required to progress in the program, so you need to get at least a C in this class. Exams. During the administration of all exams, all personal belongings must be placed against the wall in the classroom or the library, wherever we're at. No hats or caps can be worn during the exam. Faculty will not answer questions during the exam regarding the exam content, and I will not answer questions before the exam of things that you don't know or that you're not sure about. So if you have questions, the time to ask is during class. No cell phone calculators will be allowed during exams. Makeup tests, exams, or quizzes. If a student takes a test outside of the scheduled time, this will be considered a makeup test. The test must be made up within 1 week of the original scheduled time. Failure to do so will result in a 0 for that test. A student may miss one test without penalty as long as the test is made up. If the student misses more than one test, the test may be made up, but the maximum score allowed is 80%. Any further makeup tests are a maximum of 50%. Kaplan. I know that you've all taken Kaplan before, and this is the same thing. We will do an OB Kaplan test that will be, I think it's a little bit farther down in the semester, so you get a little bit more OB stuff behind you, which will be good. Okay, and I do expect that everybody will take the test and be there. Okay, and then you'll have some remediation to do. Okay, so if you have questions about the Kaplan, please let me know. I think the next page is all the rest of the Kaplan. It talks a little bit about students must satisfactorily complete 45 hours of clinical in this class. And that is all set up in your calendar. Hopefully you've all got your calendars by now by the time you're reading this. Missed clinical days will require makeup and will be scheduled with the instructor. There is already one makeup day scheduled for the class. So it's at the very end, I think maybe December 11th or 15th. I'm not sure what day it is. So make sure you keep that day, the makeup day, open, because you never know what's going to happen over the semester. Okay? If a student does not pass clinical, he or she will receive a grade of F for the course and must repeat the entire course, including theory and clinical. You have to pass both the theory and both the clinical. You have to pass them both or you don't pass. Okay? Please refer to the clinical for clinical assignments, and we're going to get there. The next page is page 12, and this is a reflective journal. So this is a class reflective journal. So every week you will do one of these. They're built into your schedule. They're on the calendar. You'll have 1 week from class. So you'll have class on Tuesday and Thursday. So on Thursday, this thing is due the next Thursday. I gave you an extra day instead of what the thing said, 6 days. But you'll have to do this every week, once a week for all of your classes. So if we have a class on Tuesday and you want to do it on the Tuesday class, that's fine. You can still turn it in that next Thursday or whenever it's done. And the same with if you do it on Thursday, you can do both classes or just the Thursday class. I don't care, but you will do one of these a week. Okay. And then the next thing on our list, this very top part is part of the reflection, so don't worry about that. The next thing is the nursing preclinical assignment, which is worth 100 points. This should be loaded up on Blackboard for you. This needs to be finished before you start clinical. So it needs to be finished and done before you start clinical, and I think the due date on this is October 23rd, but you'll have to look at your calendars. So, and there's a lot of information in here for antepartum, which is before you have the baby, and intrapartum, which is while you're having the baby, and postpartum is after you're having the baby, and some newborn stuff too. And there are 1, 2, 3, 4, 5, 6, 7, 8. There are 8 sheets to this assignment. So you will need to do them and then upload them to Blackboard so I can grade them. Okay? And what I'll probably do after you upload them to Blackboard is print them all out, grade them, and then scan them back to you so you have them. Okay, so I think this is October 23rd. These have to be done, but look at your calendars to be on the safe side. Okay? The next thing in your little book, which is page 21, is oral presentations. There is, at the end of the semester, I think it's weeks maybe it's week 8. I think it's week 8 we do oral presentations, and there will be a sign-up sheet the first day of class, and there will be 2 to a group, and you'll each pick a topic, and you will do a presentation on this, okay? You're going to collaborate and develop an oral presentation using one of the pre-selected topics by faculty, which we've got down here. Sign-up will be done the first day of class. The purpose of the oral presentations are to encourage exploration and greater understanding of a selected topic, to provide the student an opportunity to demonstrate formal oral presentation skills, and to share important information with nursing peers and utilize evidence-based practice. Presentations should not exceed 15 minutes, but I don't want them to be just 5 either. 10 to 15 is good. References are required to enhance scholarliness. At least 2 references must be cited during the presentation, and a list of references must be provided for students and faculty. So we'll talk more about this as the semester goes on, as the 8 weeks go on, but just so you know that's coming, okay? And there is also in your syllabus, this is the rubric for the presentation, so make sure you hit all this good stuff, okay? The next thing is your course calendar, and it is 3 pages long, and it's pretty colorful if you want to print it in color. I hope that I didn't make some of it too dark, you won't be able to see it, okay? And right here it says your pre-clinical assignment is due October 23rd. So that will have to be done. And then you'll have your class reflection, which we've already talked about. You won't have one for the first week and the last week, but you will have for the other 6 weeks. A few of the weeks have a ticket to class. Okay, one of the weeks that we do our Kaplan exam, which is on, where is that? It's on week 6. You get 90 minutes for a Kaplan exam, and this class is only an hour and 50 minutes, so we're going to have a very short class period. So one of the things I want you to remember is that in the little, about 4 hours that we have a week to go over OB, there is a lot of stuff to it, and we can't get to it all in class. So you are very responsible for every piece of information in your book that you need to know for your tests and stuff. I'll try to help you out as we go through classes, but you are responsible for that. Then the next few pages are your weekly objectives. So they are in here too, and there's a whole bunch of those pages. From page 26 to page 30, and they look like this, okay? So they are in here for you to look over as you want, or each week. Let me have a little drink. Okay, the next thing we're going to have, that we're going to talk about, is a clinical syllabus. And this is the second part of your syllabus. So this is for your clinical, okay? We will have 2 adjuncts teaching with us this year. One of them will be Dr. Debbie Chambers. She will be one of the adjuncts at St. Elizabeth's. And the other adjunct will be Professor Melissa Wilson, and she will also teach you at St. Elizabeth's. There are 4 groups of you. I will have 1 group at St. Elizabeth's, and I will have 1 group at Bryan. Okay? Our clinical days are going to be Monday, Tuesday, Thursday, and Friday, and they're all from like 2 to 3, 4, 5, 6, 7, 8:30, 2 to 8:30. And we come off the floor. I want you there 15 minutes early. And actually, St. Elizabeth's is going to change because they changed their times to start till 2:30. So it'll be 2:30 to 9, but you'll be there 15 minutes early for pre-clinical conference. And then the Bryan people, I have to talk to them yet, but I think we're going to start at 2. And I want you there 15 minutes early so we can talk about your assignments and stuff. The last hour from 7:30 to 8:30 we'll be off the floor in clinical conference. So we will talk about the patients you've had, questions you have. We might get into some disease processes and things that are going on with OB patients. So just to give you kind of an overview, we have also, let's see, the course calendar. Let me get mine. We have 3 dates scheduled for for tours of the hospitals, and we are not going to do this during class time either. So the first day is going to be October 10th from 4 to 5 at St. Elizabeth's. I will give you a tour then, so whoever can come that day should come. And then October 11th at St. Elizabeth's, also from 4 to 5. I will give you a tour there too that day. So you have, if you're a St. Elizabeth's clinical, you have to come to one of these two, okay? And then October 12th will be the Bryan clinical, and that will be from 4 to 5 also. And if you're at Bryan, you have to come to that one. It's the only one I have, okay? So make sure and get those dates on your calendar. And now we'll start on the clinical syllabus, okay? So students participate in clinical experiences in a variety of settings. So we go to the hospitals, we go to clinics, we go to doctors' offices, we don't go to nursing homes in this clinical, because we deal with young patients that are having babies. So we do not go to nursing homes. Students care for patients with stable disease processes. Care provided by the student is under the supervision of the clinical instructor and the resource nurse. Students provide care under supervision of the clinical instructor and or the resource nurse, including medication administration, health assessment skills, documentation, physician order review, and any other deemed appropriate by the clinical instructor. The following activities are not permitted regardless of the clinical course. So you cannot take orders from a physician, whether he's right there in front of you telling you something to do, or whether it's on the phone. You cannot take an order, okay? You cannot serve as a witness to a legal document. You cannot administer IV chemo. You cannot verify doses of high alert medications, and some of the high alert medications you're going to see in labor and delivery and postpartum. Pitocin's the biggest one, is a high alert. Heparin you'll see, insulin you'll see, blood you'll see. So all of these you will see in labor and delivery, maybe, depending on the day. You cannot engage in any activity a nursing instructor decides is inappropriate for a student to do under the circumstances. Okay. Students must always have a clinical instructor present for the following procedures: removal of a central line, which we will not do in OB, administration of IV or epidural narcotics, controlled substances, including a PCA, which we will probably do, and IV heparin and insulin, IV insulin, which we may do. Okay. Students are assigned to a clinical group of 6 or 7, and I think our groups are 5 or 6 this year. The pre-licensure program coordinator selects clinical groups. The students remain in the group for the entire course. Extenuating circumstances may necessitate group reassignment. Students also participate in experiences that are observational only. Students must adhere to the assigned facility's dress code, policies, and procedures. During observation experiences, students are not to provide any patient care. Students may have a written assignment for their observation experience that is submitted in Blackboard via the day after the observation experience. So anytime you do an observation, just like PED, you have 24 hours to get it in. There is an observation form that you will fill out as observation reflection. It must be submitted to Blackboard. Okay? Okay, so clinical objectives. I am going to let you read over those, because there are a lot of them. So make sure and read those. Okay? And we are going to go now to page, I'm going to read my pages here, 33, and we're going to talk about clinical expectations. Okay? Safety, nursing process, hierarchy of needs, communication, advancement of clinical skills, advancement of assessment skills, along with the advancement of the understanding of pathophysiology to include medication, labs, diagnostic tests, and other significant data. Okay. Clinical modules of instruction. A variety of teaching strategies applicable to the clinical experience will be utilized each, such as patient care, case studies, demonstration, return demonstration, discussion groups, and or individual supervision, pre and post conferences, journaling, and concept mapping. So you can do all that stuff. Assessment of clinical student progress. The clinical instructor will assess knowledge base through observation, discussion, and questioning during the patient care. Medication is administered safely will also be an important area of the patient care that will include verbal questioning and direct observation as to the action, therapeutic response, side effects, and proper medication administration. The one thing about OB is they have a limited amount of medication. So in labor and delivery, maybe 10. Postpartum's a little different. They have a few more, but not as many, depending on the patient. So you are going to be required to know what the medication you're giving is for, what the side effects are, and hopefully our instructors will be asking you that, and that you can answer them. Okay? Clinical evaluation methods. Clinical will be graded on a satisfactory, unsatisfactory, needs improvement basis. Remember, when you get a needs improvement, that's okay, because you're learning, so you should need improvement on some things. It's the unsatisfactory things that you want to worry about. Okay, refer to clinical evaluation form, which we'll look at here in just a few minutes. Students must obtain consistent satisfactory marks on all the clinical assignments and clinical objectives to attain a satisfactory evaluation for the clinical component. The student will be evaluated each clinical day and/or weekly per the clinical evaluation form. The instructor will provide feedback by the end of the clinical week regarding performance strengths, areas needing improvement, and a summary of observations, conclusions, and recommendations. The student is to critically review their own performance and incorporate instructor feedback into future clinical experiences. The student and instructor are responsible for signing the evaluation form each week, indicating that feedback has been given by the instructor and reviewed by both the student and the instructor. I was going to say something and now I forgot what it was. I hate it when that happens. Oh, I know. You all will get a folder like you did for PEDS, and I know at PEDS we got it about halfway through the 8 weeks. Hopefully we will have those folders ready for you to go this time when we get started in OB. So we'll go from there. And the same thing with that. Your evaluation sheet that we're going to look at will stay in there for me to work on, and your all of your reflections that you do for clinical, I will need them. I'm not sure how we're going to do it. We'll probably do it the same way. They'll be uploaded, and I'll make my notes and re-upload it to you. But you are responsible for making a hard copy and putting it in your folder, and making sure that there's one there for every week that you have a reflection. Okay? A narrative midterm evaluation and final evaluation will be completed by the clinical instructor and the student to review progress. The midterm evaluations is graded on a satisfactory, unsatisfactory, needs improvement basis. If the student receives an unsatisfactory on the midterm eval, the student will be at risk of failing clinical. The student must pass clinical to pass the course. If the student does not achieve a satisfactory for each objective by the end of the clinical rotation, this indicates that the objectives were not met and therefore constitute a clinical failure. The student must achieve a satisfactory on the final evaluation as well to pass the course. Okay? A clinical remediation plan will be completed for at-risk students by the clinical instructor and signed by the clinical instructor and the student. The student must follow the clinical remediation plan and correct behaviors identified by the end of the course. Students who are at risk at midterm must achieve satisfactory marks on the final eval. The student must achieve a satisfactory for each objective by the end of clinical rotation. More than 2 unsatisfactory marks in the course will result in a course failure for the clinical portion. Okay, and now we're on page 35. More than 8 hours of clinical absence during any course with a clinical component may result in course failure or an incomplete of the course as determined by course faculty, and that's why we set up a makeup date for you so you don't have this. If a student does not pass clinical, the student will receive a grade of F for the course and must repeat the entire course including theory and clinical. Students are responsible for completion of all assignments. The student must successfully complete clinical to pass the course. The student must also pass the theory portion to pass the course. I bet you guys are thinking, she's told us that 20 times now, and you're probably right, I probably have, but you have to pass theory, you have to pass clinical. If you don't pass one of them, you don't pass the whole course. Self-reflection. Students complete a clinical self-reflection each week of clinical. This may be through journaling or prompted questions. The self-reflection will be due within 24 hours after clinical. Please refer to the course lead faculty for due dates. Clinical faculty will provide narrative feedback. There is also a form in your syllabus, and we'll look at it in a minute, for your reflection. And that'll have to be uploaded to Blackboard too. Okay? Late paperwork for clinical will be graded as unsatisfactory. So when you have 24 hours, you have 24 hours, or we graded unsatisfactory. Student, you will have to take a math test the first day of class, which we do. There are 5 questions on the math test, and you have to have 100 before you can be a part of this class. You get 3 tries to pass it, but we'll do that the very first day of class. Okay? Clinical requirements. Students in the lab are expected to respect school property. Failure to do so will result in a failure of the course. Name badges are required for clinical experiences. And remember, your VSIM is clinical. Your lab, your simulation lab is clinical. All your clinicals, your observations, they are all clinical, so you will be in your Wesleyan scrubs with your name tag on, with your hair up if you're a girl with long hair, the way it should be. Okay? You have to show up on time. If students are late for any of those clinicals, we're going to send you home, and then you'll have a missed day. Okay? Special circumstances will be addressed on a case-by-case basis. If the student will be absent on a clinical day, the student must notify the clinical instructor and clinical area at least 30 minutes prior to the start of the clinical shift. Students are required to follow the nursing program dress code for this experience. Please refer to the student handbook. Noncompliance will result in dismissal from the clinical area. So don't come to clinical with a blue scrubs on because you are black scrubs at Wesleyan, because we will send you home. Okay? Refer to the student handbook for dress, hair, uniform, and other regulations. So tiny earrings in your ear, white shoes, white socks, black scrubs, name tag. Okay? Any violation may cause the student to be sent home and clinical failure for the day. Students are expected to act in accordance with the ethical standards placed upon a nurse according to the American Nurse Association standards. Failure to act with honesty and integrity toward a patient, other students, or faculty member may result in clinical failure. Something squeaky outside my window. Students are responsible for obtaining their own patient information after the faculty member selects the patient. The clinical instructor will inform the students of when and where their assignments will be posted. Early arrival to the clinical start time is suggested. Unsatisfactory preparation may result in dismissal from the clinical area. So what happens in labor and delivery and postpartum is your adjuncts, your professors, and myself will get up there before you, and we will make your assignments. And you'll come in, we'll sit and listen to report if there is report, and then we'll go out and meet your patients, look at their charts, all that kind of stuff. Okay? A concept map is required for each assigned patient. Each new patient assigned requires a new concept map unless directed otherwise by the clinical instructor. The concept map is due within 24 hours of clinical. Okay. Hospital document, and we are going to go over concept maps in our first day of clinical, or take that back, our first day of class, so you know, because OB patients, they're a little different. They're not always really sick. They have some other issues, and sometimes they have some sickness, but not always. Okay? Hospital documentation with patient identifiers, name, social security number, or medical records, etc. are not to be removed from the facility. It's a HIPAA violation. Any information you put down in your care plans, your concept maps, whatever, your med cards, has to be very without patient identifiers on it. Okay? Don't scan anything. Don't send anything to your email. Nothing. You have to do it while you're there. If you cannot demonstrate that you are prepared to care for your assigned patient, you may be sent home and receive a clinical failure for the day. Students must be fully prepared by knowing their patient's medications, treatments, and patho of the patient's illness. And this is a takeoff from your other, like your med-surg classes. We're not going to have so much of this because our patients aren't sick. And they do, you know, if I go in and assign the patients the night before, they're probably not going to be there the next day because OB patients move around a lot. Okay? Students must be able to describe equipment and steps on any procedure or skill. Hospital policy and procedure manuals and skills textbooks should be utilized. No procedure or skills are to be done without the instructor's presence or approval to proceed. The clinical instructor must review and see every medication before it is administered to the patient. And at Bryan, I have another little card that goes with my name tag that you have to scan to say I was there with you when you gave the medication. Just so I'll remember that, but hopefully you will too. Giving medication without the supervision of clinical faculty or resource nurse may result in automatic clinical failure for the course. Students will be expected to discuss drug information for the assigned patients. Students must report off to their resource nurse and the clinical instructor prior to leaving the clinical area for break and at the end of the shift. I'm going to try and get you all out for break at the same time. It doesn't always work, especially in OB, in labor and delivery. You might have a patient that was 6 and you're all going to lunch, and now all of a sudden that patient's complete and going to have a baby. You don't want to go to lunch then. You want to stay and watch her have a baby. So we'll see how that works. It didn't work out so hot last time, but we'll see. We'll see what we can do. Students must attend pre- and post-conference. Pre-conference will take place immediately prior to clinical and is facilitated at by the clinical instructor. Post-conference will take place immediately after clinical and is facilitated by the clinical instructor. Pre- and post-conferences are times to discuss assigned patients, clarify misconceptions, and cover any other topics of interest. Students are encouraged to take a 15-minute morning break and a 30-minute lunch break, and this will be a 15-minute afternoon break and a 30-minute supper break. Okay, students are not permitted to leave the clinical area during the clinical day, but you can go down to the cafeteria, or down to the coffee shop or whatever, as long as I know where you're at. Clinical makeup day is provided for students who have unexpected and unavoidable situations arise that necessitate absence from clinical. More than 2 absences in a course with a clinical component will result in a clinical failure or incompletion of the course. Valid extenuating circumstances will be evaluated by course faculty to determine course failure. Use of handheld devices. Students are encouraged to appropriately utilize online resources via computer or handheld devices to enhance learning. Use of the handheld device in the clinical setting is regulated by clinical agencies. All students are fully responsible for following all regulations of the HIPAA Act. Students are prohibited from using cameras in the clinical setting. Inappropriate use of handheld devices or violation of HIPAA guidelines will result in disciplinary action. Students are expected to implement the values of Nebraska Wesleyan University. Any knowledge of unprofessional, unethical, or dishonest behavior will be fully investigated. When you are on the floor as a student nurse following another student, the only time you are allowed to use your cell phones up there is if you need to look up something on, oh shoot, it's right at the tip of my tongue. The program that you've downloaded to this, the resource program. I can't remember what the name of it is now. Isn't that awful? Anyway, you know what I'm talking about. That's the only time. If there's an emergency at home, please excuse yourself and leave the floor. I don't want you out in the charting room on your phones. I do not want to see Facebook. I do not want to see emails. I don't want to see no homework to do. You'll have plenty of paperwork to do while you're there. Okay? So if you have questions about if you can use your phone or not, ask, and your instructor will tell you. Okay? Fines and fees. Clinical or lab absence fees. After 16 hours of absence in one academic year, the student will be charged $50 for each additional clinical-related course experience that requires schedule adjustments. The student will still be required to make up clinical experiences. The fee defrays part of the cost of providing clinical makeup sessions. A $100 fee will be charged to any student who is a no-show or does not call to report an absence for any clinical or lab experience, regardless of the number of absences incurred. Students may utilize the skills lab for extra practice of skills during any course. The skills lab schedule will be posted outside of the lab and on Blackboard. Students may access the lab to practice outside of clinical days when there are no activities in the lab. Students need to sign up for extra times with their instructor. An instructor or skills lab assistant must be present. Students are responsible for leaving the skills lab neat and clean, as well as for school property and that is damaged. Take a drink, everybody, if you need one, because this is long. Hopefully we're getting closer to the end. Now we're going to talk a little bit. I'm on page 38 on my syllabus. I hope it's the same for yours. Each student will participate in a clinical experience, a simulated clinical experience. It will provide you the opportunity to care for patients that you may not encounter in clinical environment. The simulated clinical learning environment allows you to apply content that you have already learned, expand your knowledge of course content, critically analyze different applications of course content, practice your clinical judgment, and learn from making mistakes in a controlled setting. You will maximize your learning experience by treating the simulated clinical experience just as you would a clinical experience in the healthcare setting. The more real this is for you, the more you will learn. Upon completion of this learning experience, it is expected that you will not share details about the simulated clinical experience with your peers. Refer to your clinical schedule for the dates you are assigned to these clinical experiences. Adhere to the dress code, so once again, scrubs. And bring your stethoscope and watch and all required preparation work. Reference books are provided in the simulation lab in addition to access to the internet. No food or drink is allowed in the lab. Everyone participating in activities is intelligent, well-trained, and cares about doing their best, wants to do their best, and wants to learn from the experience. We invite you to collaborate with us on your journey to be the best you can. You are expected to arrive prepared to learn and participate. You are expected to treat the simulated patient with the same care and respect as an actual patient and would expect to be treated. The inability to participate in a professional and ethical manner will result in dismissal from the lab. Follow dress code per student handbook. No cell phone usage for personal calls allowed. Same here, not only personal calls, but no Facebook, no email, none of that stuff. Assessment of learning. Evaluation of student learning will be conducted to evaluate whether students have met the objectives for their scenario. The evaluation will be recorded in the student's weekly clinical evaluation. Students will conduct evaluation of experiences. These results will be tabulated and included in a course evaluation at the end of each semester quarter. Preparation for these simulated experiences. It is permissible to collaborate with other students in your group when preparing for the clinical experience. However, collaboration with any student who has already participated in the simulated clinical experience is strictly prohibited. So don't go ask Monday's group, if you're Friday's group, what happened on Monday, because that's not permissible. Each scenario notes a list of skills that you may need to successfully care for the patient. Review your any health assessment or psychomotor skills as needed during the preparation. You are expected to perform these skills during care of the patient. Your preparation and participation will be evaluated according to the same clinical outcomes. Okay. Audio, visual, and recording. It may be used in the simulation lab. Recordings may be used during the debriefing period. I probably won't do that, but we will have a debriefing period. The recording can be viewed by the students who have participated in this only and the instructor. The videos will be securely stored. It may temporarily be placed on the learning management system, but password protected so that the participants may access it. The videos will be deleted from the computer at the end of each semester. Under no circumstance will videos be viewed by other people without written consent of the participants. The video will not be uploaded to any public viewing sites such as YouTube. If a faculty member wishes to use portions of the video for educational purposes or as part of the conference presentation, they will obtain written consent from the participant prior to use. Okay? Okay, so the next thing on page 40, this is your clinical evaluation sheet, and I bet you've all seen it. It should be in your folders for your instructors at clinical to fill out. It should stay in your folders until the end of the semester. Okay? There's a lot of sheets to that. A lot of sheets. Let's see here. I'm about done maybe, I think. It goes up from page 40 to page 46. And then on page 47 is also the signature place for you and your instructor to sign, and it also has your missed days down here if you miss anything. Okay? Your absentees, I guess is what they call it. And then there's a midterm evaluation. This should be in your folder. And sheets to that. And then there is also a clinical remediation plan that we talked about earlier that's in your folder. Or no, it's not in your folder. We'll just get it if we need it. And then there is a final evaluation for your last week. And then the very, very last page is your self-reflection template. So this is what I want you to use when you're doing self-reflection of your clinical. So there you go. That is your syllabus in a nutshell. Please take notes, ask, and put down questions if you have them for the first day when we're in class. And we'll go back through there and see if we can figure out whatever you need to figure out. I am not going over this syllabus in class. We are just going to hit the high points and anything you have questions on. So please let me know if you have questions and bring your questions to our first class, which is coming up pretty soon. See you all later.